Hi guys, this is Dr. Bhupesh. Again, introducing our team of Norcet and Clicks. We have got Aparna Joseph. She is working in PGI since last 8 years. Would be our guest lecturer, followed by Tanu ma'am. She's a New York registered nurse. Looking forward to register as a Canadian nurse, and changing her license into Canadian nurse. But she's already a USA New York registered nurse. And now, and Tanu ma'am is working in Aims at the moment, so she has cleared her Norcet. And then we have got Raman ma'am and her Kiran ma'am, our NCLEX heads and team of Dr. BKM. So they are going to be there to help Aparna ma'am, Tanu ma'am to reschedule their lectures and to take care of everything. Raman ma'am is an Australian registered nurse. Our Kiran ma'am has been the topper and has been with Dr. BKM for a very long time. Myself, Dr. Rupesh, as you guys must be knowing. So let's talk something about, because we have got a lot of knowledge. We talk a lot about USA and Plex. So what we are trying to present today is something about Norcet, because a lot of people, a lot of nurses are not inclined towards Norcet. So we have got Aparna ma'am, Tanu ma'am, and Raman ma'am herself, even being Australian nurse, she also has cleared a Norcet. So she also worked in Aims. So now we will talk about it. How can we help people being Dr. BKM to register themselves in Aims, PGI? How can we do these things, ESIC, DSSBB, other government exams? So let's talk a bit about it, and please subscribe our channel. Every weekend we will discuss about these things. Today I'm sitting in a cafe, sorry about that. But please listen to the information carefully, because we want to provide you the best information. And Norcet, we also want to spread the awareness, because Aparna ma'am guided me. Aparna ma'am, what do you think? Like, what do people know about Norcet? Like most of the people in our Punjab, especially, they are inclined towards NCLEX going abroad. So how do you feel about Norcet?
Thank you so much, sir, for this opportunity. I'm glad to be a part of BKM Institute. So, discussing about NORCET, it is Nursing Officer Recruitment Common Eligibility Test. That
Okay.
is the full form of NORCET. Yeah,
Competent.
Recruitment Common Eligibility Test.
Okay.
Yeah. So, as we know that it is conducted by Aims, which is a central government institute, and it is conducted by.
Can be a little louder.
Okay. So it is conducted by a central government institute, which is Aims, All India Institute of Medical Sciences.
Okay.
It is conducted bi-annually, which is twice a year. So
Okay.
that's a great opportunity for nurses who are in India. Yeah. It's a great opportunity for nurses because a few years back we used to be like there are no vacancies, and nurses who want to achieve a good goal, achieve the highest position in their career, they would prefer NCLEX and all. But NCLEX is also a good thing if you want to settle in abroad. But for those who want to settle in India, their approach is just restricted to India, so they can opt for Norcet and other government exams, for which, yeah,
Who are not going abroad, they can target North,
yes, sir.
can have better salary,
Yes, sir. Yes.
life, better future. With our government
Yes, sir.
institutions like Aims, so they should
Yes, sir.
get Aims as well. Equally, they focus on NCLEX. That is also a good opportunity, but they should also focus on Norcet.
Yes, sir. If they want to settle in India.
Okay, yeah. Settling in India, having
Yeah.
good salaries around 90,000, 1 lakh. So, 1
Yes,
lakh.
sir.
So, that is a very
It's a
good.
good, handsome amount of money. Yeah.
Okay. So, Tanu ma'am, how do you feel working in Aims at the moment? What do you think? What are the facilities? What are the kind of things, skills you learn, which you do not learn maybe from here and there? Maybe handling the pressure. Is it stressful to work in Aims?
What I feel about working in Aims is that it is a reputed job when we are working here in India as a registered nurse. So it is the best job that a person can do being a nurse.
So,
Uh,
being a
First
nurse,
of all,
nothing better than Aims and even PGI.
yeah,
Yes,
being a nurse, nothing better than Aims in India, I would say. In
okay.
India, it is the best opportunity for nurses to
So why do
become a registered nurse in
nurses do
Aims.
not actually apply for these exams? They don't know about this exam, like, or maybe they are more inclined towards NCLEX. They think that salary is more over there. What do you think is the difference? What do you think, Raman ma'am? Because you have clear Norcet and NCLEX both. Like, how do you feel? Because you are an Australian nurse. How do you feel about it?
Sir, there is not much difference. Just basics should be cleared to clear both exams. Nothing else.
You're saying if the basics are good, even in India and even in foreign countries, if you're working in good institutions, kind of same. Because you have just cleared your
Yes.
OT as well in Australia, because you have learned these things that how to work. So do you think
Yes.
it's really good? Even in
Yes,
India,
sir.
the atmosphere is good.
If you are having job in PGI or Aims in India, that's best. Then there is no need to go abroad. If somebody's dream is to go abroad, then NCLEX is best.
Okay. Harkiran,
Yes.
you can also share your experience. Like, what do you feel? What would you like to do if you get an opportunity for NCLEX and Norcet? After listening to all this conversation, what do you feel like?
Sir, first of all, my dream was like I'm already having this dream that I want to become a successful person as a registered nurse in abroad countries.
Okay.
But by listening to
Again,
these
matlab,
views,
your
like
inclination is
also
towards abroad only. So how do you feel about
no,
now
no.
listening to Norcet and 1 lakh salary a month and maybe getting
So,
good environment to work?
sir, actually, really, I want to give a shot to Norcet and Aims. I really want to give.
If you are a nurse, if you are a fresher coming out of the colleges, maybe in November, so Norcet is a good exam to target. Aparna ma'am, you were telling me the date, like when is the next date coming for the Norcet? When is the next exam?
But it's 12th of April. It's a tentative
12th of
date.
April.
The mains will be in June. The
Okay.
main exam will be in June, and
Okay.
there's a possibility that even PGI in the coming future will take out certain vacancies.
Okay.
So it's a good
So
news for nurses. They can
Norcet
even opt
certain
for.
vacancies of PGI, even PGI will have its sorry, Norcet will have vacancy of Aims, and that
Yeah,
we are having an exam even for PGI may happen this year.
yeah, it can happen. So you
And
should be prepared. A student should be prepared.
okay, and the exam of Norcet is in April. So
Sir,
if we target now, suppose if a youngster is coming out, pressure is coming out, so we can start
Yeah.
November. They are coming out.
Yes.
December they should start preparation for NCLEX and Norcet both, because I
Yeah.
think
So that is
they
the
will
perfect
be
time.
the same.
Yeah. Yes, sir.
So December,
sir, I want.
January, February, March, and April, they would be able to take the exam 5 months, perfect 5 months. Great. Yes, Raman ma'am,
Exactly.
participating some.
Sir, there are two PGIs now, one in Chandigarh and one in Sangrur. So opportunities
Yeah.
are also.
Chandigarh and the
It's
other
a
one is,
part of it's a part of PGI Chandigarh. It's an extension. Yeah.
where is it?
It's
The
an
second one?
extension of
Sangrur.
Sangrur.
Sangrur. So, okay, so it's not only PGI Chandigarh that will have the vacancy, PGI Sangrur will have the vacancy. So it would be
Yeah.
good that even
Certainly.
people from our northern side, like ma'am is already from Delhi, Tanu ma'am, and she is working in Aims. So how do you feel, ma'am? Like working in Aims is obviously it's a great experience, but is it stressful job as compared to foreign countries? Like what do you think? Like you are
What
going
I
to
feel is
nursing as well. USA, you are a USA nurse. How do you feel the difference? Like why are you applying for the same?
what I feel is that in India it is less hectic. Like I am working in burns and plastic surgery department. I would say my department is less hectic, or in Aims it is less hectic.
Last
There are numerous of staff.
yes,
There are numerous of registered nurse working in the same department. Good, they are maintaining good patient ratio. So I would say it's the best thing if you're working in India. So nothing can be better than this.
so working in Aims, working in PGI again. Tanu ma'am, you are working in Aims, obviously, so you maybe can't relate to PGI. But Aparna ma'am told me a lot of things about PGI that it's like hands-on experience when it comes to working over there, and they're strict professionals and they're working under a lot of stress. To be honest, like it's not stress; they have a lot of things to sort out in one day. So great, great connecting to you guys. Thank you for this important video. I hope our nurses would be able to learn, especially the fresher nurses who are just about to come out. Please share this video as much as you can, guys, and subscribe to the channel. We will keep updating you with new stuffs, and we have got the best experience team for NCLEX and Norcet. Syllabus almost remains the same, guys. Syllabus almost remains the same. It's just about the questionnaire that would be little different, and anatomical part and physiological part would be little different. Management would be little different when it comes to NCLEX. So we will guide you for all these things. We have got the perfect people in form of Harkiran ma'am, Raman ma'am, Aparna ma'am, and Tanu ma'am to guide you. And there would be many other guest lectures like Aparna ma'am and Tanu ma'am who would be contributing towards our progress. So please call us at 76967 34256 to get more updates and to stay connected with Dr. BKN Institutes. Thank you very much, guys. Thank you.